chronic rhinosinusitis with nasal polyps is a serious disease, interfering very much with quality of life. And we need to make not only patients aware of all of this, but their relatives, their primary care providers, and their secondary care providers. And they need to know about current guidelines and about the sorts of changes that are needed to improve care.
For physicians, even more of course for patients, but also for physicians, it's very frustrating that so often you can't do what you would like to do to improve the quality of life of our patients. And for that reason, there are many unmet needs. And the most important one is reduce symptoms to normality without imposing serious side effects for a reasonable price. And both these three things we do not have at the moment.
By this first global CRS with nasal polyp awareness day, EUFOREA hopes to achieve the following outcomes. First of all, it's good to hear the burden of the disease coming out of the mouth of the patients, and we also take into account the patient's recommendations for better care in the future. Therefore, when we bring to the attention the shortcomings of the current care and the suggestions of patients for improvement of the care pathways, EUFOREA can act in conjunction with all the other stakeholders in the respiratory field to improve care for patients suffering from severe CRS with nasal polyps.
The Unmet Needs paper learned us the patient's perspective of living with CRS with nasal polyps. So we learned a lot about the impact of the disease on their quality of life. We learned a lot about the experiences of the patients with the current care they received. We learned about the current shortcomings and frustrations of patients. And we also learned how to overcome these shortcomings and how to improve future care.
For future patients, I hope to achieve that we can create a pathway for the proper treatment and that they can find the right physician to help them.